So being under the section of promising project, hopefully this one is qualifying as such, because I'm going to present to you the Aniti project in Toulouse that is currently being examined in the tender of the Institute of Artificial Intelligence. Aniti stands for Artificial and Natural Intelligence Toulouse Institute. It's led by Nicolas Acher, a computer scientist expert in speech recognition. And the design is of integrative programs that are here, 7 integrative programs. And this institute will be highly interdisciplinary, bringing together computer scientists, mathematicians, and ultimately doctors in the health application. Indeed, as known in Toulouse, we're very much into aeronautics and transport, a lot also in remote sensing, and will benefit from all this knowledge that is very advanced in the use of artificial intelligence. Also, we have bigger set is that we have colleagues from the bio-inspired artificial intelligence that are aiming at mimicking brain training to speed up artificial intelligence and to try and indeed have less data sets for going into the applications. For the health, I'll take one example that is the first integrative program, and of course I will not go into the 7 of them, but you'll see that we share the common problems of properties that have been already mentioned several times during the morning, and that the data must be, of course, fair, dependable, acceptable. And this is not only a problem of health, but also a problem that have been extensively studied by the colleagues in other fields like aeronautics and environment. So we'll benefit from this cross-knowledge, and to, if accepted, our institute will be built around small teams that are interdisciplinary, called chair. Those chair will be either fundamental, intermediate, or applied. The one that I have proposed is around medical imaging, and this application will benefit from the help of colleagues that are experts in data qualification. And indeed, this cross-fertilization is in all the objectives that have been mentioned during the morning, that the medical care being more personalized, more predictive, and participatory. That's the 4P medicine that everyone aims at. Indeed, I've been asked to speak about AI in diagnosis, but of course it's not only in diagnosis, it's obviously in treatment, monitoring, and patient management that all those improvements are expected. And the health participation in the Aniti project is focusing on 3 examples. First one is a colleague that is part of the World Health Organization labeled Gérontopole, Sandrine Andrieux, that proposes a chair on aging, and indeed for the rationale of better selecting the parameters that will help to better consider the patients for intervention. And the objective is to prevent the loss of autonomy and to design those personalized strategies to better take care of preventing aging. The method is to take the data sets, and the first presentation spoke about those data that are to be collected in the Health Data Hub, and to use techniques that our colleagues of the computer science and mathematics will help us to implement. We then have the possibility of intervention that are like clinical trials to be organized, and this for preventing the course of aging as much as possible indeed. Sandrine Andrieux, that I mentioned, is the senior of this chair, and as all those three little groups that will present, we'll see that there is a medical doctor together with a scientist and engineers that will help, hopefully, to do the job. In collaboration with Institute of Mathematics in Toulouse and Institute of Research in Computer Science, with some aspects of it already funded. Second project is in ENT, or ear, nose, and throat domain. In Toulouse, Bernard Fraisse, for several years, have been the pioneer of implantation of cochlear implants for deaf children. And now his colleague Olivier de Guin proposes to better set the humanoid robot to train the children and to telemonitor their abilities and to personalize the fitting of the setting of the implant. So the expected benefits is a better rehabilitation of the speech of those children. In his chair, Olivier de Guin is joining a colleague that is specialist in ergonomy and acceptability, which of course is very important aspect with the children, and Antoine Pillot that is making the link with the previous chair, as he's a medical doctor that is specialized in the acceptability of the captures for aging people. So they will both join efforts to see across ages what is the best way to have the patient accepting those implants. And my own specialty being medical imaging, this aspect, which has been extensively explained this morning, and that stressed exactly the good questions that are occurring from radiologists, which also have been the subject of big conference given by the European Society of Radiology over the past weekend in Barcelona, and which is on recording, giving the all exact reflect of the tremendous interest that this community is giving to the help that will be brought by artificial intelligence. So in my own little group, we will address the possibility of trying to smaller the data sets in using differently the information that is in imaging. Over the past decade, we have invented several types of imaging, and now we are trying to link them together in one idea to aggregate those information and also to objectivate them. We've seen in the morning that it's difficult to have segmentation of imaging, and one way is indeed to try to use artificial intelligence not to have to segment and to take the whole entirety of the information, to put it under geometry that is capable to be calculated by information geometry, and to see whether this helps to look at the images through the follow-up of the patient. And in a specific situation that is the one of the therapeutic trials, because the conditions are very strictly reproducible, which helps very much to make the proof of concept of whether artificial intelligence would eventually be able to return back the information to prediction of prognosis. This being worked on in vivo imaging is quite simple because it's all digital. And eventually, while using those parameters in terms of histograms, this biomarker extraction could work with cellular imaging as far as it first, of course, has gone through the step of the recognition of shapes, as we've been seeing this morning in one of the presentations. So in my little group, there will be a mathematician that will help with all these aspects of calculations, and an expert in imaging, together with some engineers that will see over with the constitution of cohorts that could simplify the problems of calculating those images. A lot of collaborations, and we see that we have not only collaboration with in vivo imaging, but also cellular imaging. And I noticed that in the first communications been said that it's unusual to have the possibility to have pathologists and radiologists together, so that will be the case in our group. And as well as the colleagues from the National Civil Aviation School. And this is very promising because the idea of using distribution instead of region of interest or voxel-based analysis, this histogram analysis, so distribution, came from the situation of the analysis they do in flight delays. And so the Civil Aviation School has an extensive program on artificial intelligence. And indeed, we're trying to mimic the situation they have with the flight delays with our medical imaging. Therefore, it's taking from images, we extract the histograms, so whatever parameters out of it. And so two strategies, either we want to classify from some selected feature or to extract them, and the classifier, and then the evaluation. So far, we're just in machine learning. Indeed, if the institute being built, there will be some manpower that will be given to us in this possibility will be extended to deep learning. One example of the results of using histograms is the classification of Alzheimer's disease population. Not a big challenge in terms of imaging, but the original idea here is to take some anatomical parameters that are usually not that quantified, and in terms of atrophy, here with all the curvature inside, outside curvature, turn all of that into histograms and apply the machine learning extraction that we've mentioned. In Alzheimer's, the idea is not to qualify Alzheimer's disease versus access control. All of the algorithms do that very well. Indeed, it's to be able to qualify stable mild cognitive impairment versus progressive mild cognitive impairment. And of course, this is not as good as this figure that we have here. This is a training situation. And in fact, the example that we will focus very much on is the one of clinical trial with the multiparametric imaging. And indeed, it's multiple sclerosis among the neurodegenerative disease, which had the most extensive use of multiparametric imaging. So this is the first example using 4 biomarkers from diffusion imaging, from magnetization transfer imaging, and for the anatomical cortex measurement that we've seen before with Alzheimer's. And the idea is to use small data sets, 40 patients, to see whether repetitive, very strict situation of a clinical trial with a treated group and a placebo group could be read extremely fast over the possibility of machine learning. And the proof of concept is quite well done, except that, as you may see, the drug wasn't efficient, so this needs further application to other clinical trials, but there are not that many clinical trials so far that have all the biomarkers used. It's just a start. And what is very interesting is to see that all the groups seen at month 0, month 12, and month 24 are exactly summarized under the same situation, meaning that this approach of machine learning indeed put all the variability of every patient all together and makes it even. So this is very promising, and when we eventually have this institute going on, then we'll benefit all of us from the learning that we will have from all the colleagues from mathematics and computer science, and the health community will then be able to have run the 77 programs that we've listed in the Toulouse Hospital and the Cancer Center. And if willing to classify those programs in terms of examples of applications, 35 of them involve in vivo imaging. So this is no surprise that radiology is probably the first specialty that is interested, but not only. The application is for somewhat in diagnosis, and that's most of the examples that we've had this morning. Treatments in some of those, monitoring, but overall patient management. And there's a lot of those applications that are to be helping triage the patient, prioritize the order of interpretation, or taking the patient, or putting some resources in the emergency. So we're matching very much what has been mentioned by others this morning. And obviously, all this interest in healthcare is quite going in the same direction in the very many places. Thank you very much for your attention.